why do you say that you don't see it getting any better? You wrote your book back in 22. Since then, there are a number of instances that have happened. This one surely doesn't make a case for any kind of betterment. But have you sensed any kind of reforms that have taken place?
There's absolutely nothing. Like they made it worse, right? With the Jan Vishwas Act, they made it worse. And beyond that, we are just not seeing any reform. So we keep reading in the newspaper where the national drug regulator, the CDSCO, keeps claiming that, oh, we went and did joint inspections with state regulators. We have shut down so many plants, etc., etc. But we can't find the name of one single plant mentioned in the newspaper. Similarly, with cough syrups, after the tragedies in Gambia, Uzbekistan, the Ministry of Commerce, under whom drug regulation does not fall, they invoked a trade law to set up a testing requirement for export, mandatory testing requirement. That so all the export consignments were being tested in government labs, and it was the press reported that about 100 samples had failed testing in those government labs, cough syrups. So we knew that there was a problem. They did not release the name of a single cough syrup into the general public, despite the
Yeah.
fact that those same manufacturers who export also very likely sell in domestically in India. So this was just a matter of time. The writing was on the wall. We were just not surprised. Dinesh and me, we were just not surprised when this happened.
So help me understand this. What will it take to ensure that this is the last of the deaths that we are seeing because of contamination of drugs or spurious drugs, etc., coming into the market? What do you think? What's the solution here?
It will take an act of God, honestly, given the way politics is running in this country right now. But if the optimist in me were to talk, I would say like a very low-hanging fruit, something that even the courts can do if they're interested, is to order the state and national regulators to make available all test reports, all inspection reports that they have done. So, for example, that if we knew how many times this particular facility was inspected in the past, and who did the inspections, we would then know how to fix accountability. And the moment drug inspectors know that their inspection reports are going to be made public with their name on it, they will start taking their job more seriously, because they know when a tragedy like this happens, it is going to be their head on the line. So greater transparency, as you know, that saying goes, transparency is sunlight is the best disinfectant. Uh, the only way I see things changing radically is if we infuse a large dose of transparency. And that is, again, very, very difficult in today's India.
All right, but that's a good suggestion, and we hope that people are taking due notice of this. I also want to understand this from you. Mr. Reddy, India prides itself in being an affordable market when it comes to drugs compared to a lot of countries out there. We pride ourselves in having more penetration of medical care, etc. But this a story like this, when cough syrup deaths, IV deaths, etc., happen, we go back and question if brands are what we are to go for. In this fight between branded drugs versus generics, where do you really stand?
I think most of them are bad. It's, I mean, you actually can't tell, because a lot of these so-called branded guys, like the big, really big top 10 big guys in India in the pharma industry, a lot of them engage contract manufacturers. So if you look at the fine print on the packaging, it may have the label of the big brand, but the manufacturing facility is actually somebody else's, because these guys use their own facilities mainly for the export market. For the Indian market, they depend on contract manufacturers. So the fact that something is coming from a branded facility is no guarantee in India, because if you read US FDA inspection reports of the biggest brand facilities in India, that's a different horror story on sanitation standards and data fabrication, et cetera, et cetera. So there really isn't any guarantee. And you ask doctors, even they don't know. I mean, this everybody is cruising on prayers and luck. There's no concrete way to pin down quality in India right now.
Mr. Reddy, you paint a very, very sorry picture. Is there some hope? Is there something that you want to leave us with in terms of what we as citizens can do, what we can ask our policymakers to do? One change, perhaps, that we can bring. We've been bringing a checklist of sorts to tell people, read the ingredients, look out for this ingredient. But even if it's the right ingredient, you don't know if it's the quality, how substandard, etc. it is. Is there anything that you want to leave us with on a positive note? Because this is it's a serious, serious problem.
Yeah, I mean, see, it depends, like some certain kinds of medications which are more sensitive to quality issues. I would say trust your doctor. I know like Indians are very cynical about their doctors today, but for a lot of, like, for example, nervous conditions, neurological conditions, thyroid and all, where the medicine is very sensitive, trust your doctor's judgment because doctors are constantly prescribing drugs and they get feedback from their patients. So even if it's a little bit more expensive, it's okay. Trust your doctor on that count. For stuff like cough syrup and all, just try and avoid it because even doctors say that a lot of doctors disagree with the fact that cough syrups are even required.
Yeah.
Beyond that, there really isn't much for me to add unless you want to, petition the health minister and ask him to do something about changing drug regulation laws in India. That's as far as I can recommend.
All right, Mr. Reddy, if the health minister was listening to you right now, what would be your one piece of advice to him?
I would say make everything transparent, make inspection reports transparent. The government does a lot of testing, make those test reports public from state labs and government labs. Government does a lot of procurement itself. And it does testing on those procurements. Those reports should be available because this is not a problem limited to smaller manufacturers and small cities. Last week, AIMS, the All India Institute of Medical Sciences in Delhi, where a lot of VIPs get treated, they put out a press release saying that intravenous fluids that they had procured, they detected contaminated fungus in them. It's reported in the news. And they then banned the manufacturer. Now, when something like that, something as serious as this is detected in a manufacturing facility in a premier government hospital, alarm bells should have rung across the world, across the country, to withdraw other stocks manufactured by this company. That never happened. So these questions need to be asked of the government. Why are they not withdrawing these stocks when they detect that there's something contaminated? So there's no silver bullet. We need a complete system overall.